Everyone. My name is Becca Heinze. This is my second semester with the Discapaz program. I'm a second-year doctoral student studying special education.
Hi, everyone. My name is Sarah Valderrama. I am a second-year school psychology master's student here at University of Arizona, and I'm with the Discapaz team also.
Hi, my name is Yulitza Velasquez. I am currently in my junior year of undergrad in pre-med, and this is my third year with the program.
Hi, my name is Chloe Thompson. I'm a biochem student and Spanish major in my sophomore year. This is my first year a part of Discapas.
Hi, my name is Kim Hernandez. I'm an undergrad student studying rehabilitation studies and service. This is my first semester and this is my first year with Discapas. This project is called Discapas, Disability Experience in the Borderlands. It's focused on sharing real-life experience of people with disability who live along the Nogales border. The goal of this project is to use storytelling as a way to highlight important themes like strength, resilience, and every life experience. This project is especially important because it gives a voice to people with disabilities that are often overlooked on research. By doing this capacity helps bring attention to this group of people. Also, this project represents inclusion and promotes social change.
And then for our study, we worked with a small group of participants, including participants with people with disabilities and one supporter who joined in, and a total of 8 participants. Majority of our participants were from the Nogales, Sonora side, and one of our participants was from the Nogales, Arizona side. As part of the data collection process, we had participants take part in a scrapbooking workshop where they collaborated to co-develop a digital story that helped them share their experience in a creative and accessible way. We collected interviews after, either individually or in pairs with a supporter, and these interviews were done via Zoom following an initial meeting to establish rapport with the participant, and participants were able to communicate in whatever preferred language or communication style that was accessible for them. For our data analysis, transcripts were reviewed after interviews, and our research team had multiple rounds where we looked at the data individually and then came together as a group in agreement to develop a shared codebook. And we realized that there were participants who shared similar experiences that didn't necessarily fit the original codes we first created, which then led to new codes being added, for example, such as challenges in sharing one story in Figure 1. And then we had to repeat the process all over again, where we then had to go through all the transcripts now with this new updated code book and then come to a consensus again and see what the frequency of the codes we then found, which you can see in Figure 1 here.
So after going all of our 8 interviews, we found a total of 106 transcripts. So overall, if we go back to Figure 1, as Sarah mentioned, you're going to see all of our, codes, which are going to be empowerment, identity, supporters, connectiveness, and community, advocacy, challenges in sharing one's story for personal use, and challenges in sharing one's story. So overall, we found, our top 4 is empowerment. Anytime someone mentions a life experience and any kind of personal growth, we would identify it as that. Then we have identity. This is how a participant sees themselves or in relationships with others. Connectiveness and community is basically the engagement with the physical space or anytime they have some sort of interaction with the group. And advocacy is when the participant is planning or is educating others or spreading awareness on their disability or just being a general member of their community.
So through clarifying the codes and subcodes, we now have a springboard to dive further into thematic analysis in order to further explore how multimodal storytelling methodologies can contribute to empowerment, identity development, deeper connection, and sharing one's challenges. The limitations in our study included a small sample size and a small regional representation. And the authors want to acknowledge that our positionalities influence how we look at data. And so that is contributing to where we're at.
As for our next steps, we plan to continue the analysis of the codes. Right now, we have coded sections and we want to analyze that data further to identify themes or themes that connect between the codes. And since one of our limitations was a smaller sample size, we wish to expand that by continuing our recruitment for storytelling. And we want to do that with continuing our collaboration with community partners. And since one of our other limitations was a small regional size, like Becca mentioned, we want to do our study in more Arizona Sonoran areas, since we just looked at the Nogales side for Arizona and Mexico.
That's exciting.
Okay, our next presenter couldn't be here in person today, so she did record her presentation in advance. So we'll go ahead and play that.
Good afternoon, everyone. My name is Jennifer Haggerty, and I am excited to share with you the work that I am doing within the partnership between the State of the States in Intellectual and Developmental Disabilities and the Association of University Centers on Disabilities, the AUCD. Data Ambassadors is a 5-year program that identifies 11 USED or LEND trainees from across the nation to participate in data literacy and state-specific networking opportunities. As a 2024-25 USED Developmental Disabilities Certificate trainee and current LEND Fellow, I was chosen to represent Arizona in this year's national training cohort. I share in the Data Ambassador mission to become more knowledgeable in national disability data to advance leadership in policy, education, research, and practice. Let us first look at the data that the State of the State collects. Dr. Shay Tanis and her team at the University of Kansas are collecting national data on basically 2 things: money and people. Specifically, adults who have a clinical diagnosis of IDD and are receiving services through a state home and community-based service waiver program. We also want to know how these folks spend their day and what type of setting they live in. Lastly, we track the funding and the costs associated with supporting these individuals to live in their communities. Data is tracked on a 2-year revolving cycle. In the first year, the data is collected, and in year 2, the data is analyzed. Currently, we have data from 1977 up until the year 2023 and are collecting data from fiscal year 2024. The data is collected from primary sources such as state developmental disability agencies and secondary sources such as the Census and the Social Security Administration. However, all numbers have to be verified and approved by state developmental disability directors. Now more than ever, access to this data is essential in driving policy. With the shift in our political climate, funding for many essential services for healthcare, education, and employment are at risk. Currently, Arizona serves an estimated 60,000 members with IDD, a number that has almost doubled over the last 10 years. Arizona has 1 state institution left in Coolidge. It no longer accepts new clients, but will allow its 40 remaining residents to age in the place that they call home and will close their doors when the last resident passes away. This follows national data trends on the decline in institutional care, with the projected date of all state institutional settings closing by 2041. With more people transitioning from institutions to living in their homes and communities, we would expect to see the rising cost of waiver services decline. In Arizona, 77% of IDD members live with a family caregiver, with 61% of those family caregivers being over the age of 41. This data highlights the need for additional funding for waiver services, as many IDD programs already struggle with workforce shortages, decades-long waiting lists, and budget infrastructure stability. This data allows us to learn from the past and prepare the way for the future of individuals living with dignity and respect within their homes and communities. Data Ambassadors has been a rewarding project for me. It built on my last year's research of home and community-based service waivers and gave me valuable skills in data literacy, analysis, and accessibility in how to apply data and the power of storytelling. Most recently, I used my position as a data ambassador to share Arizona state-specific data at the Disability Policy Seminar. I met with staff members from Senators Gallegos and Kelly's office, as well as Congressman Siscomani's office, to educate them on the lived experiences as a parent caregiver and use data to advocate for policy and systems change. Also, last month I met with Arizona District 17's Representative Kevin Volk, as well as Senator Vince Leach's office, where I shared this data to educate them on the importance that waivers have on individuals and families right here in Arizona. Arizona and other state-specific data are available via the QR code listed on this poster. You can also learn more about data ambassadors at stateofthestate.ku.edu/data ambassadors. I am proud to be a data ambassador emerging leader, and I offer up myself as a resource to you. I would be more than willing to give a presentation to your organization on the importance of utilizing data in advocacy. I'm sorry not to be there in person today, but my contact information is listed on this poster for any follow-up questions or presentation opportunities. Thank you so much and have a great day.
Our next presenter also was unable to come. She was actually attending a conference today, so she was sad she couldn't come, but she did record her presentation as well.
Hello everyone, my name is Yesenia Rivera, and today I will be presenting my honors thesis titled Historias de Salud para Cambio, or in English, Health Stories for Change. My thesis was conducted under the mentorship and supervision of Dr. Yumi Shirai and the Sonoran Center for Excellence in Disabilities. So to preface, during my freshman year, I took a class centered around health disparities faced by different groups, and through this class and my involvement with the Sonoran Center, I learned a lot about the challenges people with intellectual and developmental disabilities, or IDD, face within healthcare settings. These challenges often result in adults with IDD facing difficulties in accessing quality care, especially when compared to adults without IDD. Additionally, there's a lot of research that shows that individuals from Hispanic or Latino communities also experience difficulties when it comes to receiving quality healthcare services. While the disparities for these two groups individually are well documented, there exists limited research on what an individual's healthcare outcome looks like when they're a member of both identities. That gap in research is what inspired the first portion of my thesis, a narrative literature review. To conduct the literature review, I used various keyword combinations in 3 distinct databases, the UA Library database, PubMed Central, and ProQuest. And from the narrative literature review, I identified 19 sources that met my established criteria for inclusion. Those sources were focused on adult populations, were published within the last 12 years, were originally published in English, and focused on services/experiences within the United States. From those 19 sources, several key factors were identified as contributing to disparities. Those factors included language barriers, lack of culturally relevant care, and different biases and preconceived notions of healthcare providers. Many of the sources that I decided to include cited person-centered care as a potentially effective approach for improving healthcare experiences. Person-centered care essentially refers to care that's focused on giving an individual a platform to share about their experiences, and their experiences are used as the guide for care that they ultimately receive. And then a key part of person-centered care is providing people with the opportunity to share their experiences with healthcare providers. Learning about person-centered care is what led me towards the second part of my honors thesis, adapting self-advocacy materials for use in Spanish-speaking populations. Dr. Shirai helped to connect me with the translated their already available self-advocacy materials to Spanish and worked very closely with a Spanish-speaking self-advocate. That self-advocate helped to ensure that materials were both culturally and linguistically appropriate for use within Spanish-speaking populations. They made different suggestions of edits to make to enhance readability and comprehension of the Spanish materials for native Spanish speakers. They also made several suggestions in terms of improving physical accessibility of the resources, like adapting the resources so they could be used with assistive devices like screen readers. Following that feedback, I did adapt different materials so that they could be used within a wider population. And then furthermore, I worked to translate different health story promoting questions that follow the person-centered approach outlined in Creative Cafe materials used by the Sonoran Center. In the future, continuing to implement specific case studies with self-advocates with a wide range of disabilities could help to further improve the current accessibility of materials for use within a larger population. And then in the future, we hope that these materials can be piloted with another Hispanic, Latino, Spanish-speaking self-advocate to further evaluate the effectiveness of the adapted materials so that they could potentially be used in a broader statewide project. If you'd like to learn more about this work, please contact either myself at jrivera5@arizona.edu or my mentor, Dr. Yumi Shirai, at wyumish@arizona.edu. Thank you for your time.